Hi, my name's Holly Hadley, and I'm a nurse practitioner student for Athabasca, and I will be presenting assignment 1. I have chosen a 9-year-old coming in with a complaint of a 2-day history of sore throat. JH has presented to my clinic. He's a 9-year-old Caucasian male brought in by his mom. I have been his physician since he has been 5 years old. He's come in with mom stating that in the last 2 days he has had a sore throat that has been causing him body aches and pain and has been decreased appetite. So, onset, 2 days. Location, the pain is in his generalized throat area, radiating to both ears. He states the pain is like a burning sensation and increases with swallowing. He has no cough or runny nose and has not been able to eat any solid foods. He has been having liquids and very minimal intake. Aggravating or relieving factors are cold foods. He's enjoying freezies. They seem to help a little bit, but the best is Tylenol and Motrin. When they begin to wear off, he starts to feel worse, the pain increases, and his body aches and pains as well as chills. On a severity intensity scale, I used the 1 to 10 scale, and he described it as a 7. And associated symptoms, treatments. So his mom has tried Tylenol and Motrin, both given last night, 15 mils of each. And this morning she gave 15 mils of Tylenol at 8 a.m. It is now 2 p.m. in my office. JH has had strep throat several times this year, 4 so far, with last treatment 2 months ago with Pen V. On review of systems, he has no complaints of runny nose, no cough, has body aches and chills, and a mild headache to the front area. Immunizations are up to date, and he takes no drugs prescribed, no over-the-counter, and he has no allergies to medication and or seasonal. So in my clinic, JH is an active 9-year-old boy. He's up to date on his immunizations, and he is active playing both hockey and soccer. Mom noted 2 days ago when they were away on a hockey tournament that he was starting to complain of a sore throat, and that 2 other kids also have been diagnosed with strep throat as well that were at the hockey tournament. Today he told his mom that he was feeling still some body aches and pains. He felt a little bit better after the Tylenol was given. He had some Gatorade and water so far today, but no food. He denies any cough, shortness of breath, or runny nose, and states the pain is localized to his throat and ears. When asked, mom states that he does snore at night and has been getting more frequent sore throats just in the past year, and has had 4 other occurrences this year alone, and was prescribed Pen V for 2 out of the 4 times, and was stated it was tonsillitis the other 2 times with negative cultures. For past medical history, JH was born spontaneous vaginal delivery at 40 weeks, and mom breastfed for 6 months. He had frequent ear infections and was prescribed amoxicillin several times, and they eventually decreased in occurrence as he became older. For social history, he plays hockey and soccer, attends school, and does fairly well. Has 2 older siblings, and mom and dad both work. Dad is in the Navy, and mom works at the bank. So today on my objective exam, general appearance, JH is slightly pale, under eyes are slightly sunken, and conjunctiva and sclera are both clear. Pupils are brisk and reactive, size 3, and accommodation and convergent are also intact. Ears are reddened, canals, non-bulging TMs, gray and shiny, and the cone of light is seen. He has no periauricle or post-auricle lymph node enlargement or tenderness. His nares are patent. There are no evidence of polyps or ulcerations, and there's good air entry to both. No rhinorrhea is noted. His sinuses are palpated, and there is no tenderness over any sinus area. On throat exam, the oral mucosa is slightly dry and a little pale, but there is no stomatitis or lesions to the external, and his tongue is pink and no lesions as well. Tonsils are a grade 3 bilaterally with white exudate noted and erythemic. He has malodorous breath as well. Anterior cervical lymph nodes are tender and mobile. They are a 1 to 1 centimeter and they are enlarged. Submandibular tonsils, or the submandibular lymph nodes, are also inflamed and tender, but they are mobile. And there are no posterior cervical lymphadenopathy, and his supraclavicular lymph nodes are non-enlarged or tender. His cardiac exam is good S1, S2 heard, no associated murmur noted, and his cap refill is less than 2 seconds to all fingers and toes. His radial pulses are 2+ on either side, and his pedal pulses are also 2+, and there is no evident edema noted to the periphery. On respiratory, his air entry is clear and clear over the trachea. There's no stridor noted. He has no wheezes or crackles and has no work of breathing, no accessory muscle use is noted. No central or peripheral cyanosis as well. Lung expansion is equal. And his vital signs, he is 39.1 temperature, his heart rate is 110, blood pressure is 100/65, respiratory rate is 20, and he's 99% on room air. His weight is 31.8 kilograms. To summarize, JH is the 9-year-old male with a complaint of sore throat for 2 days. He has had an elevated temperature and is slightly tachycardic in my clinic, as well as dehydrated. His tonsils are enlarged with exudate, lymphadenopathy of the anterior cervical lymph nodes, as well as the submandibular, are enlarged and tender and mobile. He has no cough, but complains of a headache and pain with swallowing, and his appetite has decreased. Cardiovascular and respiratory exam are unremarkable, aside from the tachycardia, which may be secondary to dehydration and a high fever. No murmur is present, and the patient has no history of rheumatic fever. He has had 4 throat infections in the last year, this being his 5th. Twice was positive for group A strep, and he was given Pen V for a 10-day course for both times. Last treatment was 2 months ago. He is not taking any medications, and immunizations are up to date. Mom has been using children's Tylenol and Motrin again for pain and fever control. Thank you very much.